La salud es lo más importante. Sin salud no somos nada. Mi nombre es Oscar. Trabajé 16 años en la industria del granito. Yo era el que trabajaba para mantener el hogar, pero lastimosamente ya cuando me enfermé ya no pude trabajar, ya no pude ayudarles. Yo creo que si no me hubieran hecho el trasplante, yo no estuviera ya contando. Sí, porque yo por último ya no podía respirar ni con el oxígeno. El doctor me ha dicho que es de por vida, tomar medicina de por vida por los pulmones, para que el cuerpo no rechace los pulmones. Antes del trasplante fueron unos momentos demasiado difíciles que yo llegué a perder toda la fuerza y aunque tenía el oxígeno, no era suficiente para mis pulmones. Me tuvieron 3 días entubado dormido porque mis pulmones habían colapsado.
Silicosis is a chronic lung disease that occurs due to inhalation of respirable crystalline silica. It's awful seeing patients come in that are young, extremely sick with an irreversible disease they didn't know they were at risk for and have almost no options for treatment. We really try to get people to lung transplantation, which is a complicated process and not everyone's a candidate for it. The average survival is 6 to 7 years after transplant. People have lots of different reasons for mortality after transplant. A lot of them are infection or rejection or both. Here in the San Fernando Valley, the predominant group that's affected are relatively young or middle-aged, usually Latino males. And it's been surprising to see some extremely young patients in their mid-late 20s, 30s. We're seeing an accelerated form of silicosis among countertop workers, predominantly due to high exposures with the cutting, fabricating of engineered stone, which is much higher in silica content than natural stones like granite or marble. The product is really what's dangerous. To be an educated consumer is really to save lives in this scenario, and so you can make different choices, and there are equally priced alternatives to high silica engineered stone that you should consider for your kitchen.
LA County currently accounts for the majority of cases in the state. It's considered the epicenter of silicosis, not only in the state of California, but also across the country. In the last year alone, silicosis cases have gone up by 100%. So we are likely to see cases continue to rise over the next months and years. We have a team of outreach workers who go out to fabrication shops and design showrooms to talk to workers and employers about the current Cal OSHA protections and regulations. We do believe that the Cal OSHA regulations greatly reduce a worker's exposure to the disease through wet cutting, through wearing the correct personal protective equipment. However, we also feel that there is no safe way to work with this toxic product.
Most of the cases were happening in my backyard in the Pacoima Sun Valley area. This bill was to prevent people from dying. People are still going back to those jobs. People are still going there knowing that their peers are dying because they need those jobs. So if we can find a way to keep people earning a living wage in an industry and also protect them at the same time, let's try to do that first. People might say, if you really want to solve the issue, then do a ban. I believe right now, industry would kill it right away. I have the ability to have industry at the table right now, coming up with other solutions.
Good morning, folks, and welcome to Palm Springs. This is the meeting of the Occupational Safety and Health Standards Board.
So in the time since we first proposed this in December,
engineered stone is definitely much more toxic to work with than natural stone. So we said really we need to prohibit working this material at all. This is a public health crisis. While we wait, while we talk about it, people are getting sick and dying, and there's nothing we can do about those who've already been exposed, but we can stop future exposure and prevent more cases.
The ban proposed by WOMA will not effectively address the cluster of silicosis cases in Southern California. It will not stop the unsafe shops from operating and endangering their workers. We know compliant stone fabrication is happening in good shops. It's possible, it's feasible, it's happening because we do it.
As an industrial hygienist, I do believe the material can be worked with safely. But as someone who sits here and listens to testimony, I believe it's not being worked with safely. I don't know how we fix this problem.
En ningún momento supimos de que esos materiales causaban silicosis. Pero yo pienso que mientras haya esos materiales siempre va a haber quien los trabaje y gente que se va a estar enfermando siempre.